and I really appreciate Saudi German hospital doctors and nurses for doing that. Anyway, to cut the story short, after the CT scan, they found out, and of course, endoscopy and having a video, taking up some sample on my internal organs, then they established that, which is of course devastating for me, and it's sad news, saying that I'm actually having a stage 3 centimeter duodenal cancer in my body. So I was shocked. But at that time, all my vitals are already stable, so I requested to be released from the hospital. Although Dr. Ghosh was advising that, I have to do the surgery as quickly as possible because it's actually a confirmed duodenal cancer. But I was having doubts in my mind, so I requested that, can I schedule the 23rd of February as the date of surgery after I consult with, the family, because I have to really, think about it and be ready and be prepared for it. So with, of course, some hesitation, Dr. Ghosh had agreed and approved to release me. And he said that he will first, therefore, use that time to fly to his home country and be back on time before my surgery, because I really wanted him to be the one doing the surgery, given the knowledge and given the in-depth analysis that he had conducted and the discussion we've had. And I think it's also good that at that time as well, Dr. Ghosh has already the foresight of also introducing me to one of the best anesthesiologists, Dr. Khalid. So even before I was released, I already met with the anesthesiologist and had a discussion. Dr. Sarah visited me, and that was really a deep concern and care in terms of my welfare that I received from the doctors. Anyway, I was discharged on the 11th of February, okay? And then, I had to go to the work and just advise my boss what is happening, okay? And I was actually planning to, use that week to sort out things, prepare some things, finish up some work. But then on the morning of 16th of February, I had massive bleeding again, and I temporarily passed out on my bed without knowing what is happening to me. At that time, I sent a message to Dr. Sarah because I had her number, and immediately she said, go to the ER, okay, make an arrangement, and she said that no need for you to queue up and everything, just look for me directly. So, which I did, okay. So when I did that, I went to the ER, okay. I had taken a cab to go to the ER, and she was in fact ready and waiting for me, okay. And she immediately took care of me, called Dr. Ghosh, and then rushed me to the ER for checking again of my blood test. And at the same day, at the end of the day, a little after midday, they confirmed again that my hemoglobin level dropped again to the dangerous level, and I need another set of blood transfusion. Right there and then, Dr. Ghosh spoke to me, explained the situation, and said that there's no time to wait. We have to do the surgery. And I told him, but doctor, I thought you were flying. He said, if you want to do the surgery, I will cancel my flight and we'll do it tomorrow. Which I believe is something very, very admirable for Dr. Ghosh, to actually sacrifice, the time that he was supposed to come home for his family and prioritize the surgery for me. And so I said, okay, Dr. Ghosh, let's do the surgery tomorrow. I signed the consent. I spoke to Dr. Khalid again, the anesthesiologist. Dr. Sarah was also there. And I went through the surgery, which lasted more than 10 hours on the 17th of February. But what was really more surprising is that after my surgery, after checking on my situation, Dr. Ghosh actually decided not to leave and actually decided to stay until I am stable. Although he was supported by Dr. Yvonne, Dr. Amer, and a few more of his colleagues supporting me at the ICU, watching me every day. I think I stayed at the ICU for about 10-12 days before I finally moved to a private room. And during that time, the support that I get from the hospital, from the doctors and nurses and the staff, was really quite motivating, because they really made sure that I'm moving, I'm able to walk, they push me to the limit that I am capable of, okay, so that I can recover faster. I went back to the private room, still having some tubes, okay, but having a positive outlook that I'm getting better. And that is all thanks through the doctors and nurses of Saudi German Hospital. So Dr. Gosh was visiting me almost every single day. I think to clarify, it's every single day that he's actually passing by to check on me, checking on the nurses whether everything is being done properly, to the point that he was also involved discussing things with the nutritionist, Dr. Pranita, okay, to make sure that I'm getting enough nutrition, enough calories, so that I can recover faster. Anyway, to cut the story short, I was out of the hospital at March 25th, which is a long time of wait for me to be out of the hospital. I was still having my tubes on my nasal, NGT and NJT, okay? But even that, after a week, was removed. And I was introduced there then to Dr. Said. At that time, when I was actually released from the hospital, is the only time that Dr. Gosh decided to visit his family. So that is really admirable for him, to really make sure that I was well and okay before he traveled. So Dr. Said now is the oncologist that's looking and checking at me. I've done already my 4th chemo cycle and on my way to recovery. And of course, there's some side effects, and they're always concerned about the side effects that I'm feeling. I'm still under treatment, but I'm 100% positive that with the support of Saudi German hospitals, and I really miss Dr. Gosh. I hope you come back soon, okay? Because I really enjoy the support you gave, and I really appreciate that whenever we're sending the blood test results to you, that you came back and give us your opinion on that. And even if you're outside the country, you're still providing the same support and guidance in terms of my treatment. That's my story. Thank you.